Hi, my name is Sufyan Hussain. I'm a diabetes doctor and academic based in London. It's been over 100 years since the discovery of insulin, and 100 years since the landmark resolution from the European Parliament was adopted in relation to diabetes, acknowledging the urgent need for action. Now, our situation has become a lot more complex. The sheer numbers of diabetes has increased with the obesity epidemic, and now much younger onset diabetes occurring in children and teenagers. 1 in 10 adults in Europe are now affected with diabetes, and these numbers are only growing. A third of diabetes cases still remain undiagnosed, opening up the potential for higher numbers being affected with complications in the future. It's not just the cost of treatment, the impact on health services, the complications, but also the suffering it causes to the individual and difficulties and burdens it places, plus difficulties in also doing tasks like working or other tasks that may be needed for living. So for us, what does this mean? It means this urgent call for action needs to be reignited. Our problem needs to be looked at in a much more holistic way. And we need to unite to think how we can stem the tide from the tsunami of diabetes that's affecting us. With this in mind, later this month, the IDF Europe and WHO Europe will be holding a high-level technical summit in Belgrade on the 28th and 29th November. This will involve 40 member associations and 30 ministries of health. Such a collective action and sharing of information is urgently needed if we are at all to find the right policies that can help stem the tide for the next generation and reduce the burden from diabetes. We have a lot of opportunities: medications, treatments, technological treatments as well, but also aspects in relation to value-based care and population health, and how we can use digital tools to maximize the resources that we have. So with this in mind, I hope that we can accelerate our action on diabetes and unite together to find the right ways of stemming the tide and hopefully making this issue a much easier one for the next generation.